Thank you, Mr. Chairman, and Mr. Fortenberry, and the members of the committee. I am Bob Haralson. I'm an orthopedic surgeon. I'm here on behalf of the American Association of Orthopedic Surgeons, which represents 17,000 board-certified orthopedic surgeons. I practice in Knoxville, Tennessee for 33 years, and we implemented DME in all 9 of our offices, and so I'm very familiar with the issues regarding DME. I'd like to thank you for the opportunity to present our concerns with many changes being implemented by law and regulation concerning DMEPOS. We share Congress' aims at increasing the quality of patient care, eliminating fraud and abuse in the federal health care programs, and reducing the cost of delivering care to beneficiaries. And it is our pleasure to appear before you today to continue our work toward those goals. With that said, I would like to highlight what we believe are some unintended consequences of applying rules meant for retail DMEPOS suppliers to physicians in small practices across the country as part of providing high-quality care to our patients. It is important to note that we are talking about physicians who supply DMEPOS only to their patients, not to the general public. And because many of our physicians who provide DMEPOS are essentially small businesses, and many provide those items to their patients because they are the only supplier in the rural areas, we are especially appreciative of your willingness to discuss this today. I'd like to take you through some of the concerns we have regarding new and revised rules pertaining to the provision of DMEPOS to our patients. Specifically, I'd like to address the application of DMEPOS quality standards to physician suppliers, the quality standard accreditation process for physician suppliers, and the impact of the DMEPOS competitive bidding program on physician suppliers. Collectively, these changes threaten to interfere with the continuity of patient care and the primacy of the patient-physician relationship, and significantly increase the financial and administrative burden on many physicians participating in the Medicare program. Currently, the rules make no difference between large retail DMEPOS suppliers and physicians who are also serving as DMEPOS suppliers solely during the course of caring for their patients. I'd like to personally thank CMS staff for their willingness to work with us on how quality standards are applied to physicians who enroll as DMEPOS suppliers. However, the AAOS believes that one-size-fits-all approach to the quality standards is not in the best interest of patients and will have an adverse impact on a patient's ability to access DMEPOS from their physicians. We have made CMS aware of these concerns, and while staff have acknowledged the difficulties of applying quality standards to physician suppliers, the AAOS is concerned that CMS believes it lacks authority from Congress to provide flexibility for physician suppliers in setting quality standards. This is certainly an area where we would request the committee's assistance. The second major topic I would bring to your attention is the burden of the quality standard accreditation process. We acknowledge and share congressional and CMS interest in ensuring Medicare beneficiaries receive high-quality care, supplies, and service. We are equally committed to ensuring that patients have access to the care and supplies that they need in a safe, efficient, and timely manner. Unfortunately, our members are finding it increasingly difficult to participate as DMEPOS suppliers. In most cases, orthopedic surgeons are submitting claims for a small number of DMEPOS items. However, in order to go through the accreditation process, physicians' practice will be charged approximately $3,000 per location for accreditation. We have spoken to some small practices that provide as little as $1,500 a year for DMEPOS billings. This leads me to the specifics surrounding the competitive bidding process. Using the public comment period, we express our concerns to CMS about the costs and burden associated with competitive bidding. We would like to applaud CMS for their decision to exempt physicians from having to competitively bid, particularly DME, including crutches, canes, walkers, and folding manual wheelchairs. We are, however, extremely dismayed regarding one of the other category of products subject to the competitive bidding program, and that is off-the-shelf orthotics. In the final rule, CMS did create a separate exception from the competitive bidding process for off-the-shelf orthotics, but only extended the exception to occupational and physical therapists and did not include physicians. Many patients require immediate access to these items for mobilization of injury support, facilitation of safe mobility, or post-surgical recovery. It is unsafe and clinically inappropriate to delay a patient access to items by sending a patient out of a physician's office without the necessary DMEPOS. We are hard-pressed to understand why CMS did not include physicians in the exception. Finally, I'd like to leave you with a few recommendations. First, regarding quality standards and accreditation, we'd seek your support in recognizing that physicians are already trained to provide and administer DMEPOS to patients. We firmly believe that given the complexity of today's health environment, steps must be taken to ensure that they are not unnecessary or duplicative efforts required of program participants that would discourage patient access to care. In terms of providing public confidence that the providers and suppliers of orthotics are trained and qualified, we believe that professional society credentialing and training processes and state regulation of practitioners already provide the necessary safeguards in this area. Therefore, while we understand the need for a process of this nature, we ask not that physicians and healthcare professionals be exempted from having to be accredited, but rather that they be deemed as having met requirements and accreditations once they are licensed or credentialed to practice medicine under state law. In the event that this is not possible, we ask that for delay of accreditation deadlines for new and existing suppliers so that more coherent set of quality standards can be applied. Lastly, with regard to DMEPOS competitive bidding program, our recommendation is simple. Add physicians to the already existing exception for off-the-shelf orthotics. Failure to exempt physicians would cause significant access and patient safety issues. I'd like to thank you, Committee Chairman Schuler and Ranking Member Fortenberry, and members of the subcommittee for the opportunity to speak to you.